Hello, I'm Nick White. If you are watching this, you're thinking about a kidney transplant. I'm living proof of how important they can be. Not that long ago, I received a kidney after battling a genetic disorder my entire life. Although an organ transplant sounds extreme, it can be an alternative to dialysis, and it could lead you to live a better quality of life than you would without treatment. First, let's talk about dialysis. There are two types: hemodialysis and peritoneal dialysis. Dialysis can be life-saving, but is not always the best answer for patients. Dialysis is time-consuming, can negatively affect how you feel, and does not always help your quality of life. Now, as for a kidney transplant, that can restore kidney function to normal or near normal levels. A kidney transplant does mean surgery and healing time. You will also be on immunosuppression medication for the life of your transplant. Unless you have someone willing to donate a kidney, you are likely to spend some time on a wait list before you receive a kidney. Any person who has kidney failure, is on dialysis, is close to being on dialysis, or has a GFR less than 20 may be eligible for a kidney transplant. A kidney transplant is a demanding operation. You need to be in a reasonable state of health in order to fully heal. You will also need to carefully follow your post-transplant plan. That includes a required support system to ensure a full recovery. The average wait time on the kidney transplant wait list is several years, but it can vary depending on a number of factors, including the type of kidney you're willing to accept, your age, and your blood type. The best option for a successful transplant is with a living donor. The expected survival of the kidney is based on the age, laboratory values, and medical condition of the donor who has died. This is known as the Kidney Donor Profile Index, or KDPI. The KDPI is scored on a range of 0 to 100. Kidneys given a score of 0 are expected to have the longest survival. Living donors will provide their kidney through a separate surgical procedure. This is done laparoscopically with small incisions and surgical scopes. Living donors go through a separate in-depth evaluation to make sure they are fit for donation. You still have options if you have a living donor, but they are not a match for you. In a paired exchange program, a patient who has a donor that does not match them can swap kidneys with a similar donor-recipient pair or be a part of a longer swap chain. Talk with your transplant coordinator for more information. During surgery, the new kidney is put behind the abdominal cavity in the pelvis. The surgery often lasts 2 to 4 hours. Blood vessels of the new kidney are attached to blood vessels in the lower part of your abdomen. This is just above one of your legs. Finally, the new kidney's ureter is connected. The ureter is a tube that links the kidney to the bladder. After the surgery, you will wake up with an IV, a urinary catheter, and sometimes a drain in your side to remove excess fluids. Typically, the inpatient hospital stay is 3 to 4 days. Most kidney transplant recipients can return to work and other normal activities within 8 weeks or less after their transplant. You will not be allowed to lift objects weighing more than 10 pounds or exercise other than walking until the wound has healed. Now, I know this can be a lot to take in. That's why it's critical to know that you are in the right place. The transplant program's outcomes often exceed the national averages each year. You can find specific information by looking at the national reporting resources.